On today's Two on Your Side Town Hall, a new COVID-19 mutation on the move, the newly discovered Mu variant, and why health leaders are keeping their eyes on it. Plus, why the fight over a horse deworming drug is the latest battle of the COVID pandemic. And we're getting ready for some football and talking Bills with Adam Bonini as we count down to Sunday. And hi there, everybody. I'm Kate Welshofer. Michael has the night off, so I'll be holding down the fort here on the town hall tonight. So you've probably seen a lot of headlines lately about the drug ivermectin and the controversy surrounding it, like this one today from NBC News, where a wife actually went to court to try to get the drug, which is normally used to treat parasites, prescribed to her husband. There is a lot of misinformation out there about this, and that's why the Verified team looked into it.
We continue to get emails from viewers about ivermectin, like this one from Joanne. So she wrote us saying there is good evidence that ivermectin really is effective for COVID-19, even though the FDA and CDC are bent on selling the vaccine as the only answer. Now, we've done a lot of research on this, and this is just not true. That's according to the Federal Drug Administration, Centers for Disease Control, the World Health Organization, Oregon Health and Science University, and the manufacturer of ivermectin, Merck. They all say that ivermectin should not be taken to treat COVID. Ivermectin is a drug meant to prevent parasites in animals like horses. Ivermectin tablets are approved at very specific doses for people for treating parasitic worms or in a topical form for head lice. The FDA said taking large doses of this drug is dangerous and can cause serious harm. The Oregon Poison Center at OHSU has received 9 calls this month about people intentionally misusing ivermectin. Compare that to only 3 cases of people misusing the drug in all of 2020. Now, several viewers have sent us links to studies like this one, studies and clinical trials as proof that ivermectin works. But again, that's just not true, and here's why. Merck, the manufacturer of ivermectin, said there is no scientific basis for a potential therapeutic effect against COVID-19 from preclinical studies. Merck also said there is, quote, a concerning lack of safety data in the majority of studies. Again, this is coming from Merck, the company that makes the drug. Then there is more information from the National Institute of Health, or NIH. NIH said the studies of trials of ivermectin when it comes to COVID were lacking in terms of information, scope, and methodology. NIH said there is insufficient evidence to make a recommendation on the drug. They also said that lab research shows that ivermectin may kill viruses in a test tube, but no clinical trials have reported a benefit for human patients with those viruses. I talked to Dr. Marcel Kerlin about this. He's an associate professor of medicine in the Division of Infectious Diseases at OHSU. He's also the medical director for occupational health. He said just because something works in a lab does not mean it will work in the real world.
If you have cells on a Petri dish and you put a lot of ivermectin on there, it kind of inhibits the virus. And that made people think, well, let's use it for COVID. The problem with ivermectin is those studies, those laboratory studies, use doses that are orders of magnitude higher than what you and I would get for a parasitic disease. So the problem is you run into toxicity. I believe that that is going to be an obstacle, that the doses just required is just too high, would be toxic or fatal for people. And so it may not be clinically useful, even if it works in the lab.
Up next on the town hall tonight, we want to get to a word that you may be hearing thrown around a lot right now. Twin-demic. Not only are doctors worried about this latest COVID surge, but they're concerned now about the upcoming flu season as well, which could be especially nasty this year. The combination of the two is adding a lot of stress to area hospitals and area households as Western New York families kick off a new school year just this week. So joining us live to talk about what's going around right now and how to prepare for it is Dr. Nancy Nielsen, the Senior Associate Associate Dean for Health Policy at UB's Jacobs School of Medicine. We're glad you're with us, Dr. Nielsen. And I want to begin just by going back to last year. It was one of the mildest flu seasons on record. We had mask mandates and restrictions helping to keep those numbers down. And our verified team looked at the data from the CDC here and focusing specifically on children who are back in school this week and especially vulnerable. Last flu season, one child under 18 years old died from the flu in the whole country. That's when we were masking, physically distanced, and a lot of kids were doing virtual learning. And then we compare that to the 188 pediatric deaths 2 flu seasons ago and 136 3 seasons ago. And now we're back in contact with people. Wouldn't you know, we're getting sick again. So I'm hoping, Dr. Nielsen, that you can hear me here. But what are the concerns here locally about the flu virus combined with the new COVID infections, and how serious could that combination be for the healthcare system?
Well, it's a real problem, Kate. We're very concerned. First of all, in the country, we have 300% more cases of COVID than we did this time a year ago. So that's the first thing. But when you combine that with very little flu infections, sorry, my phone was ringing, very few flu infections, and also a low number of RSV infections in kids, we are expecting both of those things to surge because it always happens in the winter. But the difference is last winter, people were being really careful. They were socially distanced, they were wearing masks, we didn't have a vaccine yet, and now things are really quite different. So with the relaxation of the restrictions, plus the fact that virtually nobody got flu or RSV last year, we're expecting that both of those will surge. And we're already seeing a summer spike in the RSV cases in kids. What the worry is that this may overwhelm the hospitals.
Yeah, and I want to talk to you a little bit more about RSV in a minute, but first I want to talk about the concern about vaccine fatigue and people potentially not getting their flu shot because they feel like between the first 2 COVID shots and possibly needing a booster, that they've already had a lot of shots. Can you address that mindset as well as the timing concerning the flu shot? When ideally should people be getting it? And how does that work with getting a COVID vaccine? What is safe there? What should we know about that?
Well, first, let me say I fully understand that fatigue. I think we all have it. So having said that, I understand it's a really bad idea to let yourself fall into that trap, because we know that the COVID vaccine saves lives. We also know that flu vaccine saves lives. So yes, we are sick and tired of this, but the only way we're going to get out of it is to take care of ourselves and those we care about, including our kids who can't yet be vaccinated. And you can get a flu vaccine and the COVID vaccine simultaneously if you need to. So that is not a concern. Originally, we were waiting 2 weeks after another vaccine when we first got the COVID vaccine released, but now we know you can give it with another vaccine simultaneously and you get a similar antibody response. So go to the doctor once, get your flu, get your COVID booster. And if you haven't been vaccinated yet, I really, really urge you to do that before you get sick.
I want to ask you about children, especially with kids going back to school. Children are showing up with COVID in hospitals, but they're also treating, you mentioned this a little bit before, children for another infection. It looks and acts a lot like COVID. It's known as RSV. Most children get it before the age of 2. They get it sometime in the winter, but again, these cases are now popping up earlier this year. So what do we need to know about this? What are the similarities and what is the best advice here? Is there a way for someone who's not a doctor to tell the difference, or is it better to have a child test for COVID just so that you know for sure?
I would get the child tested, yes. I think that's the important thing. The symptoms are somewhat similar. It's like a bad cold, runny nose, sneezing, coughing perhaps. And we do see it mostly in kids under 2. RSV stands for respiratory syncytial virus. We've known about it for years. There is no treatment for it other than supportive treatment, which is the case for many viruses. And so I think that kids who can't be vaccinated for COVID should be wearing a mask when they're indoors in public, frankly. And that will protect you, just as happened last year. It protects you against RSV, it protects you against influenza, and frankly, the common cold. How many of us went without the cold last year for the first time in a long time? So the masks make a difference.
We have about a minute left, Dr. Nielsen, and health officials have been focusing primarily on the Delta variant. It makes up over 99% of new COVID cases in the U.S. But I want to ask you about the new Mu variant. It's been detected in every single state except Nebraska. It's ramping up in California, and it's believed to be even more transmissible than Delta and may have the potential to resist vaccines, all of which sounds very scary. So what do we need to know here?
Well, you summarized what we know exactly correctly, Kate. But what we're concerned about is it more transmissible? It might be, but right now it's a very small proportion. As you know, the Delta variant makes up 99% of the cases that we're seeing right now. So we have not seen the Mu variant, which was first discovered in South America, spread. Although it's everywhere, it's a very small proportion of the cases. The big concern is it going to be resistant to the antibody protection the vaccine provides? Dr. Fauci was on TV Sunday, and he talked about that. Right now, we are watching. So it is a variant of interest, not yet a variant of concern, but that could change. A big reason why everybody who isn't vaccinated yet should get vaccinated, because here's the axiom: a virus can't mutate if it can't replicate, and it replicates by finding people who are susceptible. So the bottom line is get your vaccine as soon as possible if you're not yet vaccinated.
Such important points. We're going to leave it there for tonight. Dr. Nancy Nielsen, as always, thank you so much for your expertise. We appreciate you coming on.
Thanks, Kate.